Good afternoon. This is Dr. Do again. This video is outside. It's a alphabetic list of problems. Start with the letter C. I'm going to talk about the cubic tunnel syndrome and comparison with the carpal tunnel syndrome and other causes of elbow pain. So basically, cubic tunnel syndrome is the medial elbow pain. Elbow pain is an idiopathic ulnar nerve disease. So it's a idiopathic. The other name is called idiopathic ulnar neuropathy. So basically, the symptoms is not sport related. It's just the idiopathic without cause. You feel the pain on the medial elbow associated with the numbness, tingling of the last two fingers. If you recall the carpal tunnel syndrome, you feel the pain on the wrist, and also the first three fingers feel tingling numbness. So because the carpal tunnel syndrome is the tendons undergoing chronic damage, inflammation, and fibrosis, so narrowed the passage when the medial nerve passing by through the wrist. But this is the ulnar nerve passing by the cubic tunnel cause the numbness, tingling, associated with even atrophy of muscles. And the other causes of this is not the mechanism is different, because carpal tunnel syndrome is because the inflammation of the tendons cause the neuropathy, the compression, the pressure on the nerves cause the neuropathy, carpal tunnel syndrome. The cubic tunnel syndrome, however, is a neuropathy. It's may or may not related to the tendons or inflammation, or just the nerve cell, the nerve itself undergoing inflammatory change cause this idiopathic, which means no clear cause for this neuropathy. So this is compared to the carpal tunnel syndrome, the mechanism is different and also the pain is different. Both associated with numbness and tingling of the fingers, but the carpal tunnel syndrome is associated with the first three fingers, numbness and tingling, and the cubic tunnel syndrome is associated with the last two fingers, numbness and tingling. And there are another causes can lead to the elbow pain. What is the tennis elbow or the golf elbow? It's just related to the sports chronic degenerative change or chronic injury. Chronic injury, either medial or lateral, or the bone tissue, epicondylitis, which means the bone tissue undergoing degenerative or chronic injury cause the pain. For the tennis elbow, it's really the pain on the lateral, which means that the lateral means if you lining up with your thumb, so that's the lateral, and the pinky, the small finger, that's the medial. So if the lateral elbow pain, playing tennis for a long time, hurt the lateral epicondylitis. So that's the inflammation of the bone tissue. And for the golf elbow, just the same idea, just the different motion of the elbow joint cause the medial epicondylitis. So these are all the bone tissue inflammation. So these are the mechanism, the disease occurred in the forearm, the elbow, and the wrist and the fingers, but the mechanism are different. Just compare them. So if you play tennis a long time, you feel the lateral elbow pain because the motion, the style of the movement, stretch cause the inflammation on the bone tissue on the lateral epicondylitis. So that's the tennis elbow. And for the cubic tunnel syndrome, it's not quite common because it is not related to either carpal tunnel syndrome or the tennis elbow, golf elbow. It is idiopathic neuropathy without known cause, just the medial of elbow pain associated with the last two finger tingling numbness. If this kind of condition happen, it's very close to the golf elbow syndrome, but just the history can tell those people play golf or doing some similar motions or exercise for the arm, and also it's a chronic, long process to develop that degenerative or the injury history cause this. Any associated problem required emergency. Since these are all the chronic process, it's really not warranty emergency. However, if the injury occurred with suspicious of the fracture, or suspicious of a tendon torn, or suspicious with internal bleeding, if these are associated with the injury, acute injury, so if these are happening, so that really needs to go visit the emergency room. However, these are not the disease we're talking about, but these are the conditions, injury to the elbow or wrist, so that is the emergency. You need to go to the emergency room after acute injury. Other than that, if you have chronic elbow pain, you need to call your physician and to diagnose with the image study, or based on the history of your sports or your injury history, can make a diagnosis. For the carpal tunnel syndrome, if you are interested, you can follow up my previous video. I talk about the carpal tunnel syndrome in terms of how to diagnose it and how to diagnose it, how to treat it. The same idea for the cubic tunnel syndrome. If you tap on your medial elbow, this is the way how to identify carpal tunnel syndrome. You tap on your wrist, this area, middle of your wrist, you feel tingling, or if you do this kind of motion, you feel tingling of your first three fingers. And the same idea, if you tap on your medial elbow, you feel tingling numbness on your last two fingers. So this is pretty much can give you idea. It's a medial nerve related. It's not medial nerve. It's the ulnar nerve related disease. So you need to call either your physician or call your specialist. I think call your physician first. If your primary care physician thinks it warrants the specialist, then you go to specialist. So this is it's not quite common compared to carpal tunnel syndrome or the tennis elbow or the golf elbow. The cubic tunnel syndrome is not quite common, and it is because the etiology not quite clear. Besides, it's hard to differentiate from the cubic tunnel syndrome with the golf elbow. So unless the history can tell, you play golf or you do the same movement for a long time, develop this degenerative or long-term chronic injury. So this is, if you're interested, you can search the cubic tunnel syndrome and discuss with your physician if you have the elbow pain, medial elbow pain without diagnosis, without history playing any golf or tennis, and then your physician will do the exam and to exclude or to make a diagnosis. So this is the video for today, cubic tunnel syndrome. I hope it can give you some idea, and thank you for watching. I will see you next time.